to another episode of Fridays with Fawn. I'm Fawn Lopez, publisher emeritus, Modern Healthcare. It's a pleasure to have you on today. Today, I'm talking to Dr. Suja Mathew, EVP and Chief Clinical Officer, Atlantic Health System in New Jersey. Suja, we've known each other a long, long time. I've always admired you for your leadership, passion, and dedication to quality and your compassion to patients and their families. And you've been a great friend to me personally and to the Modern Healthcare family. It is an honor to have you as my guest today.
Fawn, I am so delighted to be with you, and I am truly honored. I'm delighted to sit down and talk to a friend, and I'm honored to be in the midst of someone who's truly a giant in healthcare. And this is an extreme pleasure for me. So thank you for inviting me.
Well, that was super kind. Thank you. I'm speechless. So let's talk. You joined Atlantic Health System last year after serving at Cook County Health and hospitals for over 20 years. Tell me about your transition from a public system to Atlantic Health. What did you learn from your experience at Cook County Health that you have applied to your new role?
You know, one would think that I could not be working in two more different organizations, from one being a very public hospital setting to now a very different environment in many, many ways. And yet the transition has been remarkably smooth. I've been extremely fortunate, enjoyed my time at Cook County immensely. And as you know, it was a deeply personally, very enriching couple decades that I spent there. But the transition to Atlantic has been remarkable. At County, probably my greatest fortune was working alongside such remarkable physicians, brilliant physicians who cared so deeply about their patients, truly every day went above and beyond to meet the unique needs of their patients. And when I was leaving a system like that, I thought there's no way that I was going to ever meet another group of such committed physicians. And that's been this wonderful surprise for me at Atlantic. I work alongside today at Atlantic Health System the most brilliant, committed, authentic, and just wonderful group of physicians and many, many other team members here at Atlantic that are absolutely committed to providing the best possible care for our patients. So it's been a wonderful, remarkably, surprisingly wonderful transition.
So as Chief Clinical Officer at Atlantic Health, you are responsible for quality, optimizing access, and quality of care. Tell us, what are some of your biggest challenges in these areas and opportunities?
Yeah, absolutely. Every challenge is, in fact, an opportunity for us to improve and do better. And that's how we have to leverage all of those challenges to be better. You know, when we think about the quality care that we provide to our patients, and Atlantic is very well recognized for the extremely high quality that we provide, it's at the hands and through the minds and hearts of our team members, our physicians, other clinicians, and our very large team member group. So I would say, you know, a real challenge is making sure that we have the right workforce to care for the diverse needs of the patients that we serve. Workforce is something we hear a lot about. Every executive leader is concerned about our workforce. I'm concerned about certainly the quantity of our workforce, but also the quality of our workforce. Again, we've been fortunate here to attract really remarkable individuals, but how do we continue to engage our workforce in the ways that we need to provide them the right support, the appropriate infrastructure to help them do their jobs, the very best job that they can do, as easily as they can do. And so I think that's the challenge for us as an organization, and all healthcare organizations, is being able to optimize our workforce.
So I'm glad you talked about the workforce.
Yeah.
So given what you just said, what do you do to address those issues, and how do you ensure that your clinicians, physicians on your team are satisfied in their careers, especially in response to burnout and all the challenges associated with the work that they do each and every day?
Yes, absolutely. So optimizing professional satisfaction, yes, for our physicians, but for every other member of our diverse healthcare team, is absolutely critical to us. And as leaders, we have to make that a priority. So, of course, providing them opportunities to rest and recharge outside of work is important. But I think the onus is upon us as leaders to create a system that really supports, again, that theme of how can they do their best work and do it easily, right? With the least amount of friction in their day. All of our team members, all of our physicians, they come to work because they want to care for people. And we have to make sure that we're breaking down any potential barriers unknowingly placed that keep them from doing their best work. So looking at that system of care, decreasing the points of friction for our physicians, removing the mundane, the rote work, and helping them work at the place where they feel the most fulfilled. Also providing opportunities for them to grow in the areas that they're interested in, whether it's clinical leadership opportunities, educational opportunities, like as in developing themselves as educational leaders, research opportunities, quality improvement opportunities. I think investing in our physicians, giving them an opportunity to grow in their chosen area, their niche, and develop themselves, is an important way that we can show our commitment and know that we can, help grow them so that they can have sustainable professions, for the long term.
Does Atlantic Health have issues associated with shortages? And how do you address the problem?
Yeah, during the height of the pandemic, we, like all other healthcare systems, of course, were challenged to keep our staffing. Of course, we had individuals that left the healthcare workforce, and others that moved from system to system as there were so many travelers, et cetera. Much of that has really calmed down. And I think, though, there's a reality for us, Fawn, that the healthcare system that we need to be creating today is one that isn't designed for today, or certainly not for yesterday, but is designed for the future. So I think when we look at workforce, we need to keep in mind that we're expecting, there are workforce shortages today that are expected to worsen over the next many years. So how can we plan for a future, optimize technology, optimize our processes, create infrastructure so that fewer people who may in fact be in that workforce can do the work more effectively and more efficiently in the future. And having said that, healthcare it's a privilege, right? And we work in a field that's an absolute privilege to be able to enter into human lives as you and I are able to do within healthcare. And I think we need to proclaim that and continue to create pathways for individuals to join the healthcare workforce. And so Atlantic, we make a number of investments in creating those pathways, creating diverse pathways as well to make sure that the healthcare workforce of the future more closely represents the patients that we've been charged to care for.
Suja, I know you're very engaged with the AMA. Talk to me about your service to the healthcare community outside of your role at Atlantic Health. Are you involved, besides the AMA, with any other board or committee work right now that you want to bring special attention to?
Yes. So, as you know, I'm a physician and turned an internal medicine physician. And the work that I've done in my primary professional society, which is the American College of Physicians, has been incredibly important to me. Currently, I serve as a regent for the ACP, and that's our board of directors. And through that work, I've certainly become quite involved with the AMA. I serve as a delegate to the House of Delegates for the AMA. I'm also an elected member of the Council for Medical Education. And I'm a medical educator at heart and grew up through the ranks of med ed. So I love that work. I will tell you also, there's some other work that I've become very passionate about. My years at the county, some own personal experience and family involvement has brought me to a place where I care very deeply about food insecurity and nutrition insecurity. And I've had the privilege of co-chairing a group called Doctors for a Hunger-Free America. That's been really important work for me. And then also I'll mention in a different type of passion for me is really pouring back into women, particularly South Asian women in healthcare and within healthcare leadership. So along with a couple good friends of mine, two Asian women, South Asian women who I had the privilege of working with and mentoring back at Cook County Hospital and in that health system, we've started a group called South Asian Women's Healthcare Collective. And we call ourselves Saucy, if you can figure out that. And it's a way for us to support South Asian women in healthcare leadership. There are certainly many, many Indian-born or Indian ethnic women in medicine, but rising through the ranks of healthcare leadership is different than being a physician or being a nurse. And I think, and feel actually very strongly that there's an opportunity for us to support one another. So that's a relatively new endeavor that I'm happy to share with you.
Well, that's awesome. And as someone who so believes in this kind of work, I can't thank you enough, and so wonderful to see the work that you're putting in towards women, not only just all women, but very specifically South Asian women. It's wonderful. And talk a little bit about food insecurities. You've passed on your passion, share your passion with your family. I just happen to know a bit about the work, some of the initiatives that your sons have started. Can you talk a little bit about the app that your two sons have developed?
Yes, yeah, thanks for asking about this. So my two sons are in their 20s now. One has graduated from college a couple of years ago, and the other is about to enter his final year of college. But many years ago, when they were much younger, so my older son, who's now 24, was just in junior high. He was walking home from school in the affluent neighborhood that he had the privilege of growing up in, and a car drove up alongside him and asked where the food pantry was. And he had no idea where the food pantry was, and certainly had never expected to have a food pantry in our neighborhood, which, as I admit, was quite affluent. And he was really struck by that. As luck would have it, a few years later, he was invited to serve on the junior board for that same food pantry. And as he worked in that capacity, he sort of met the clients, and he began to understand some of the challenges that the clients of our food pantry experienced day in and day out. So a long story, but it eventually led him and his younger brother to create an app, a mobile phone app called Got Food. And it serves as a repository of information on food pantries and soup kitchens and other feeding sites around the country. At last count, I think they had data on 32 states around the country. Don't hold me to that. Like I said, I don't get too involved in the work that they do. But what it built for us as a family was this collective passion around this work, and yet another reminder of how important it is to just open our eyes and look around us and understand understand people and the things that they need, and do what we can to help meet that need. And that's what healthcare is about as well, right? But it's not unique to healthcare. Every single one of us can do that.
Yes, absolutely. Each of us has the ability to make an impact. And so thank you for sharing that story. And I'm always struck by how passionate you are, but also how you have shared and spread that passion with your family, and together your family is making a big difference. So thank you.
Thank you, Fawn.
So let's talk about mentorship.
Yes.
You've mentored many physicians over the years. What do you believe is the secret to helping physicians become great leaders?
It's my absolute favorite thing to do. I love it. So I think, for me, I had to come to a place where I delighted just as much in the success of someone else as I might in my own success. And I'm there. I've been here for a few years where I can sincerely say that I delight in the success of the people around me. And so I think that's a really important quality in an excellent mentor. And then the other one is honesty. You have to be able to have those honest conversations with the people that you are guiding. And they, of course, have to be willing to receive that. But it's not easy to give honest feedback. It's certainly not easy to give that feedback when it can be critical. But together, you must have a shared understanding that what happens between a mentor and a mentee is in the mentee's best interest. Like, that's what has to drive that relationship. And if there's that trust that anything I as a mentor say to you is coming with that, the only thing I want is what's good for you. If you can build that trust first, it allows for more honesty and then ultimately success.
Absolutely. It's so critically important, right?
Yeah.
Feedback, I've always said the gift of feedback. People need to welcome feedback, because we can't grow, we won't grow without getting being lucky enough to receive feedback from others.
Yes.
So you've always been supportive of women and the work that you do just to advancing to helping women to advance in their careers is commendable. How can the industry continue to improve representation for women and other underrepresented groups in the medical field? And how can women support other women within their organizations? Can you talk a bit about that?
Yeah, we have to be very deliberate. We have to, in some cases, be prescriptive. We have to constantly make effort to ensure that there are diverse voices at the table. And whether we're talking about diverse in terms of gender, diverse in terms of age, diverse in terms of life experience, and every other, demographic that we could consider, we have to be very deliberate. If we're not deliberate, if I don't, in my head, have to run through a checklist anytime I put a group together and say, do I have enough of this perspective? Do I have enough of the other perspective? If I don't run that checklist through my head, it won't happen. And so, not because I don't want it to, I always wanted to, but I have to be very deliberate about it. And that's what I think we all have to do, and do it unapologetically. Because we know that when we have that diverse perspective, that collectively we're wiser. We have more knowledge, and therefore we can make better decisions.
Yep, we're better off for it.
Absolutely.
So, what has been your biggest success in your career, or maybe outside of? And what has been the biggest obstacle or barrier that you've had to overcome?
Yeah. Well, if you ask me outside of my career, you know me well enough to know that I'm going to talk about my children. My husband and I were just talking yesterday, as two immigrants, the greatest gift we've given to this country is, in fact, our two children. But within work, it's hard to pick on one particular success. I hope my career and my life is filled with lots of little successes that accumulate over time, right, to do something very meaningful. I think I can say, Fawn, that at the end of my career, and frankly, at the end of my life, there are going to be a lot of people that can attest to how I helped them be better, better physicians, better leaders. I hope better human beings. So I would say that's been my greatest success, is my ability to grow other people. And that's, that allows for this exponential impact that I think is pretty darn cool. It's pretty neat.
And what has been the biggest challenge or obstacle that you've had to overcome?
My own fears, my own fears, comfort. It's easy to remain comfortable, and it can be quite scary to take a leap and do something very different. As you know, I was in one organization for 22 years, and I knew everything. I felt like I knew everyone and knew everything, certainly about my role, but even larger around the organization. It's not easy to pick up, move across the country, and start again. And so I think that's been a challenge. It was that sense of, fear of, yes, I was successful in one environment, but is that the only environment that I could have been successful in? Was it all dumb luck? And was I really willing to take that next, to take the risk? So, yeah, I would say.
I get it. Most of us can identify
to
it. So congratulations on overcoming that fear. Okay, so let's get personal a bit. You have more than a full plate. What are the ways in which you stay grounded and take care of yourself?
So, within healthcare, I, within medicine, I mean, first as a physician, whenever I meet a patient, no matter the context of that meeting, under happy circumstances or the most tragic circumstances, no matter the sort of the countenance and personality of that individual, I remind myself that that person is somebody's loved one, right? That patient is somebody's mother. That patient is really important to some friend. That each person has immense value. And so, just knowing that everyone you deal with has such important value because of who they are, I think, keeps me grounded on who I am, right? I'm another human being that is trying to care for, a friend, a colleague, a patient, whoever. So I think it's very grounding for me. As you know, I have a very deep personal faith, and that really is what drives who I am. So that's very grounding. The time that I spend with my family, my husband, my children, my mother, my dog, yeah, this is a really important time for me. All of those things give me energy and joy, and help me do my work. And frankly, I love my work. I really love my work. And so I don't necessarily feel the need to escape my work, although it's wonderful to have time away that I can spend with other people, that I care about, that I love. But I do, I'm very blessed to have a job that I truly enjoy alongside people that I deeply respect.
Thank you for sharing that. It is a privilege, right? We're very blessed to enjoy the work that we do. So, congratulations. Okay, so let's talk a little bit about inspiration. So, who has inspired you to be a leader and why?
So there's a theme, I think, that's coming out through this conversation of mine and yours, and that's my children. So, growing up, there was a sort of a phrase in my home where I would always say to my children, challenge them with the words, "Why not you?" So they would talk about someone or something that impressed them, either someone that was close to them that accomplished something, or even, on television or in the news. And it became almost comical because my response to them was, well, why not you? Why can't it be you? And Fawn, there was a moment where my kids turned the tables on me and would begin to ask me, particularly my older son would begin to ask me, well, Mom, why not you? Why aren't you doing that?
Good for them.
Yeah, yeah. And so yeah, I could hear those words echo in my ears. So actually, they've been a great inspiration to me. But I think there's a lesson that sometimes we, women in particular, are so busy pouring into others, we may not necessarily take the life-giving advice ourselves that we give to others. And so having that mirror that my children served for me, that role of a mirror was, it propelled my leadership journey.
So I'm glad you mentioned the last part of your response. What advice then would you give your younger self about leadership or the journey to career satisfaction?
We all deserve to be happy. We all deserve work that fulfills us, that we approach with joy. We deserve that. And I don't mean to suggest that every moment of every day is going to be blissful. There will be challenges, there will be hard times, there will be failures. but we all deserve to be in a workplace, be in a profession that makes us feel really good about, at the end of the day, at the end of most days, we should feel good. And at the start of days, we should be excited about what's coming that day. I would remind myself of that, because I have certainly gone through seasons of my career where I did not feel that way. And I felt, sort of stuck in what I was doing. I didn't deserve it then. Nobody deserves that. And still, the responsibility to change my circumstance is entirely mine, right? And so that's the other big lesson for me, is that I and others, we all deserve to be fulfilled in our work. And if we're not, we need to take action. The world isn't going to change. Our situation may not change, but we can change ourselves or remove ourselves from that situation. And so I would say those are some really important lessons I've learned.
That's great. So that's really good advice for younger women, or the next generation of female leaders. So what's one other thing that you would give in terms of advice to the next generation of female leaders?
I would tell them that they should define their own success. There are many, many different ways in a career within healthcare, a career within medicine, or just in life, to be successful. And don't let someone else define that for you. It could look very different, and it does look very different for me than it looks for some of my closest friends through medical school. Our careers have taken many different and somewhat divergent paths, and we can all feel very proud of what we've accomplished, right? So don't use someone else's yardstick. If your idea of success is your career and balance between your career and other interests that you have, or the way you want to live your family life, whatever it is, you define it and stay true to what makes you feel completely fulfilled.
Excellent advice, and thank you for that. And so, Suja, I wish I could. I have more time to talk with you. Unfortunately, we're at the end of our conversation. Thank you for an absolute wonderful conversation. Thank you for sharing your story with us, with me, and for inspiring me, and for all that you've done for me and for my friends and for the healthcare industry. It's been an absolute honor and privilege to know you.
Oh, thank you, Fawn, and you know how I feel about you and your work, and just who you are and all your many contributions. So thank you. This has just been just a pleasure. Thank you.
Thank you. To our viewers, thank you for tuning in. As always, I look forward to seeing you on the next Fridays with Fawn. Please join us at the next Women Leaders in Healthcare Conference, which will be held from August 9th to August 11th in Chicago. Until then, please take good care. Thank you.